Dr. Shanna. Spouse, she's on the lookout. She would love a Gregor for her. Okay, she is a catch.
Listen.
All right. Business owner, successful business owner, confident. I could go on. All right. Hometown, born in North Austin, went through Pflugerville schools. Oh, that's an only negative. I'm just kidding. I'm in Georgetown. So Eagle Fight Never Dies. That's right. Cody and Tyler are her kids, and two furry kiddos, Benji and Darby. In business 9 years. Her hobby and interests: trail running and hiking, kayaking, reading and learning, horseback riding, spending time with family and friends, being in nature with no distractions, volunteering at Rock. And our burning desire, so many, but first to mind is to own and operate an animal sanctuary that also offers equine assisted therapy. Awesome. Right in line with that Rock, right? And keys to success: understanding your EOS, entrepreneurial operating system, being comfortable with being uncomfortable, and perseverance. Don't give up. You may not know that Dr. Shanna went to grad school at 38 years old and graduated as a doctor of chiropractic at 43 years old. So give it up for Dr. Shanna.
That is a motto I live by, and what I do in office is changing lives one spine at a time. As I mentioned, health is so vital to how we function in the world, and it's not just about affecting our own life, but it affects our family as well as the community. So as business owners in the community, if you're not on your game as healthy as you can be, it's really hard to get out there and impact the world. Family is everything for me. This is just some pictures of a family. Those are my kids over there, Cody and Tyler, and my other most important kids are the top two, Darby and Benji. So why chiropractic? So as y'all saw, I came into chiropractic a little later in life, and so when I hear people say that they're too old to go back to school, that is a lie. Don't tell yourself that. You're never too old to go back to learn more and to make a change in the world. But I dealt with debilitating migraines from the time I was about 13 or 14 throughout my life. Stroke-like symptoms, they were pretty severe. I went through all the testing, thinking I had a brain tumor and all that fun stuff, and they're just like, nope, you have classic migraines. Had a list of foods to avoid. There are a lot of different triggers I figured out. Went through years of medication that didn't even touch it. And so combine that with also working in the hospital system for over a decade, which I did love the job, but it was pretty stressful. And I was seeing sick people on rotation, and many times in the department I was in, it was the same people year after year coming in. And so I finally started questioning things like, how are we truly helping people in the hospital if they're just coming back for more tests, more surgery, more medication? And that's when I decided to do something different. That was more from a holistic approach, which is where chiropractic came into play. After I graduated, I actually opened my first office up near Tyler, Texas. Was 3.5 hours from home. Did well with the business, but really hated being away from family. So I waited till everything got really expensive in Georgetown and decided to come back here and open up last year, January 2025. That's the front of the office. We do upper cervical chiropractic, which those of you remember, you hear me talk about that every week. Visitors, I'll explain in a minute what that means and how it's different than traditional chiropractic. We also in the office offer more advanced imaging, so we're not just doing x-ray anymore, we're actually doing the 3D cone beam CT. Y'all heard Dr. Devin talk about it, they use it in her office as well. So it's great imaging, and it really gives us more insight with what's happening with the body so that we can change your life a lot easier. So in general, the services that I offer in the office is the upper cervical chiropractic care. That's what it looks like when I'm set up to do the adjustment. We also take care of pregnant moms, so we do prenatal care as well as pediatric care. Let me see if I can get, you know how will it work? If I just hit.
What's your video?
Yeah, it has.
No, it will not work.
Oh, it won't embed. Okay, well this was a cool video of the nervous system, that's all right. Basically, it was really cool because it shows how the nervous system, it starts in our brain, right? And our brain sends messages down the spine, out the nerves of the spine, to the tips of the toes and the fingers. And so that's why it's so important that we keep our nervous system free and clear so that our body can function the way it needs to. So how is upper cervical different than traditional chiropractic? Chiropractic is amazing for our health. Any chiropractor, they're working with your spine to take care of interference with the nervous system. We do that as well. We still check and adjust the whole spine, but we're specific with what's going on with the top two bones at the top of your spine, called the atlas and the axis. So I'm sure y'all seen that, I don't know the name, it's the guy that's holding the world on his shoulders, right? The atlas is his name. Well, that's what this is named after, right? Because that top bone is vital for keeping your head on straight, because that's important, because our brain stem is right at the base of the skull. So when those top two bones shift out of alignment, and it can be just a tiny bit, 0.5 millimeter, can cause a disruption in the message from the brain to the body. The brainstem tells every single system what it needs to do without us ever thinking. So it tells the heart when to beat, the lungs when to breathe, helps with digestion, hormone regulation. So you can imagine if we've got a disruption from the brain to the heart, the brain's not going to know when the heart's struggling. So it's not going to be able to heal it the way it's supposed to. And that's what I do, is I step in, see how things are aligned or misaligned, try to correct that so if there's better connection, your body will then function and heal much better. Posture is also directly affected by that top bone. If the top bone is out of alignment, it can cause our head to be tilted. Most people, and I say most because I have seen some people who have a significant tilt to their head when they're just walking. But most of us, if we have a misalignment and our head is tilted, our body has what's called a righting reflex. So it's going to get our eyes straight with the horizon so that we can walk straight. We're not walking in circles, right? But once it does that, everything is stuck. So it gets our head straight, but then the shoulder shifts. Then that causes a kink in the rest of the spine. So now our hips may be out of alignment. So we often have people come in with low back pain. We set that top bone, low back pain gets better because it's all connected, right? Some other things that are slightly different with upper cervical specific care versus traditional chiropractic is how specific we are with that relationship between the top two bones, those top two joints that connect the skull to the top portion of the spine. We do that 3D imaging that I mentioned, which is more advanced imaging these days, which helps us see the actual unique structure of your spine. That is a real life spine right there. If I had the video, it can actually, we move it around. We see 3D imaging. Those of you who have been in the office, I've shown that of your spine. And it lets us know exactly how your body is built so that I can get the best alignment for you. The adjustment itself is very precise. True upper cervical care does not involve twisting, popping, cracking, more of that general manipulation. A lot of people are fearful of that. And so if that's someone you know, they're like, oh, I think I need a chiropractor, but I'm scared to have my neck twisted. Upper cervical care is the place to go because you're very specifically looked at and then adjusted. Like that picture in the beginning, you're laying on your side and it's a very gentle adjustment to that top bone. So no forceful twisting, and then we're very intentional. Just because you come in and you may not feel good doesn't mean you need your upper cervical spine adjusted. So we have ways that we're checking you both structurally and neurologically to see, is there pressure on the brainstem? If there is, you're getting adjustment. If there's not, we're leaving it alone because that means your body is in a state of healing. I do tell people it's not really about how you feel. And that does make people mad sometimes. It makes me mad because when I don't feel good, I want to get adjusted. And when I'm not feeling good and my doc says, nope, you're holding, I'm not real happy. I want that quick fix. We all want that. But it's not about how we feel. It's all about how well is your body functioning so that it can heal properly. That's my biggest takeaway for everyone when it comes to upper cervical. So pain, yes, it's a signal. Only 20% of a nerve fiber actually has a pain signal. So just because you have no pain doesn't mean you don't have issues with your spine. But also just because there is pain doesn't mean that you need an adjustment. So it's kind of you've got to understand what's going on with the body. Your body leaves symptoms, which are clues. Those are signals to the brain. Whether you're having strep every year, that's a signal. Something's not working right with your body. But I also tell people that relief from that symptom isn't the only way we measure changes with the body. We want your body functioning better. That's the overall goal because healing is what the long-term changes in the body. It is a process though, and it takes time. So that's another thing I spend a lot of time discussing with new patients is that it's not a quick fix. Everyone responds differently, and so you just have to be patient with your body. So I'm going to share a couple of stories with y'all just to understand how people are seeing changes. This is Brandy. She's actually been one of my first clients when I opened this office. She's a business owner up in Temple. And she, high stress, we all know running a business can be stressful. She physically is under stress because she's grooming dogs all day. And she had actually gone to 2 other upper cervical docs between Round Rock and Austin for about 2 or 3 years, or actually 4 years. And she was having some changes in the beginning, but then she started noticing that she was having heightened anxiety and panic attacks. Didn't even want to go to the office. So she tried a 3rd upper cervical doctor, which was me, did that 3D imaging, and we discovered where the problem was, started adjusting her, and very quickly her anxiety and panic attacks started to come down. As I said, she is still coming as a client. She's now on more of a maintenance and seeing some really great results. This is Alex. She came at 16 weeks pregnant, so I said we do prenatal. She is also a business owner and was just real physical, and so she wanted to stay healthy so she could keep working till the end. And she did. She worked until I saw her on a Thursday. She went into labor Friday, had the baby early Saturday morning, had a home birth, had an amazing delivery. It all went better than most. I was really happy for her, and then I actually got to adjust her and the baby that following week. This is Hadley. She's one of the babies that I have adjusted. I have been taking care of her grandma. She drives in from Bryan College Station area. And when her daughter had Hadley, they noticed that she had what's called torticollis, so the head was kind of stuck off to the side, and she wasn't feeding on both sides when she was nursing. And so within one adjustment, she was nursing better, and then the head tilt went away after a couple of weeks. And so those are just some brief stories on people that are seeing some changes in the office. I also do animal chiropractic. I've talked a little bit about that here as well. Definitely one of my favorite things that I do. Adjust any animal with a spine could benefit from chiropractic, so just keep that in mind. A couple of other services that we do, we offer red light therapy, shockwave therapy, we've got some nutritional counseling. Those are all adjuncts to chiropractic. Chiropractic's the main thing, but these are other portions that we do in the office that just enhance your overall healing and health. Neuropathy program is something I do as well. We've seen some really crazy good changes with increased blood flow and nerve flow to the hands and the feet with the program that we offer on neuropathy. And then we're almost out of time. So this is something I thought I'd add because a lot of times people are like, I don't know how to refer, especially because I'm more specific with upper cervical. So if you've heard someone say that they've tried everything, they keep going to the doctor, they're having symptoms, they don't feel normal, but all their lab work is coming back normal, those are great people to come. Maybe they started having issues after a fall or an auto accident, headaches or something that they just learned to live with. That's not fun. Nobody wants to wake up every day with a headache. Those are some of the good things, things that people come to the office with that we see changes with. What I would recommend is don't just say, here's my chiropractor's card or number, because most everyone just thinks of twisting, popping, cracking as a chiropractor. And if they already have had bad experience with that, they're not even going to consider this. So I would recommend saying something more like, oh, I know someone who looks at the body differently, who looks at these special cases. Can I introduce you? And then once you hand out the card, we actually have a QR code to the website. This is what the top of the website looks like, and we have that little button at the top that says new client consultation. They can fill out a form, it comes to the office, and then my great office manager, Katie, will respond to them and try to get them questions answered or get them scheduled.
Great job, Dr.
Excellent.
Oh, one other thing I forgot to add in here because we were trying to print it out, but everything was working against me this morning. One of the things that we wanted to extend to our BNI members is we always have a new patient special every month, but whatever our special is, we're going to give y'all an additional $50 off that new patient special when you as a member come in, and then of course anyone you refer will always get 50% off of our price, right? And so just let us know.
Thank you. Yep, I was the first one to do that actually last week. So there you go. You just call the number, and Dr. Shanna actually picked up this time. She's like, it's Michael Howard. So she's happened to be there at the right time. But anyway, it's great. Thank you so much. You did such a great job. I would love to hear a few testimonials of people who've been working. Let's hear it, Emily.
Yeah, I've been seeing I took a break, but I was seeing Dr. Shanna. She helped, I was having migraines and back pain. Obviously, I am in a physical job every day, and she really helped. I was actually, my head wasn't even on straight, so she got that right, and I will be back, but she's very professional, really looks at, the images, but not only that, she takes her time with each patient, so I appreciate it. Thank you, Dr.
Yeah, Dr. Shanna got me all the time. I'm on the back right now. He said you might not feel better. I promise you do. Once you get that thing straight and you start whack a little bit, you know it. So I highly recommend something. Take a look at y'all. It's got more than a consult. If it's not with your body very fine.
Thanks, John.
Dr. Shanna is absolutely amazing. She is great, and I am glad to tell everyone I am holding, so I don't have to go in timeout after I get adjusted. So that's big news. And when you walk in, you never know what you're going to get. There's people that honestly do travel 2 to 3 hours just to see her, and then there's dogs in there sometimes, and then you get Shanna, you get Katie to stop you to come in each week. So I appreciate both of you.
Have you walked in with the horse there?
No, not the one.
One of my puppy dogs has been treated by Dr. Shanna. He went from losing his function in his back legs to completely, I would say 90% well, and back to his puppy self. So long dogs, like dachshunds, are prone to that, and we had to have another dog euthanized because of it. And had I had met Dr. Shanna before, maybe he would have had a different outcome. But I'm so grateful for what she's done.
All right, Dr. Biggie, last one.
Okay, so the best thing was my husband, she fixed my husband who had a cervical, a pinched nerve in his spine. She could probably speak better to it because I stopped getting involved after a certain amount of time. And so she pretty much fixed what the pain specialists weren't able to fix, even though my husband was he was a person who was asking for spine surgery because he couldn't deal with the pain. Even though I told him, you're okay. Of course I have a different view. I was probably a very sympathetic wife. Fortunately, the neurosurgeon said, no, sir, we're not going to do surgery on you. So anyway, so Dr. Shanna fixed them, and I refer my patients to her as well.
Nice.
Yeah.
Great job. Thank you.